And away we go.
And it's episode 13, part 1. That's Steve. I'm Al.
As usual.
And we're getting...
Nothing's changed.
Yeah. The food of the day is Hat Creek. I think we both got fried chicken.
Yeah.
Yep.
You got cheese on yours?
Yeah, they offered cheese.
Cheese on a chicken sandwich? How is it?
It's not bad. I normally get Swiss on my chicken.
Tots,
yeah, I normally get Swiss, but they gave me some other kind of cheese. But yeah, it's cheese. And I got a dragon fruit slushy.
And my typical
orange
thing.
Yeah. So we were going to start with some of the medical BS that's going down.
Well, this is legislation.
Well, yeah, legislation specifically.
Both medical related.
Let's
federal.
Yeah. If it's okay with you, I say we start with the more recent, which is the announcement about mental health, which. You want to spell it out? Because I'm not exactly... I mean, I've heard little bits, but if you can explain it better, and then I'll go over my thoughts on that.
Sure. So essentially, they've reinstated legislation, and this was happened in the past as well, where they can deem somebody a danger to themselves or others, or that they're mentally unfit and unsound, and that they're not capable of, dealing with themselves, and the language in this legislation is so vague that abuses could easily be had. Now, certainly there, some of this is questionable because, in a lot of cases, some people might need to be institutionalized, and they just won't do it, even though they are a danger to themselves or to society. And there has to be, or there should be a way to get people help when they absolutely need it. And there's a lot of gray area there. But this legislation is pushing for things that used to go on in the past where, if you go back to the 1800s, they'd put women in institutions for just like, say you're being hysterical and insane for just like reacting to abuse, And, and like some of the stuff that, went on in the early days of, in mental health facilities was atrocious. So, anytime you go into a mental facility, you're going to be diagnosed with something. Everybody is diagnosable to some degree. So with this legislation, what that means is if they decide that they don't like you for whatever reason, they can just get you off the streets and put you in an institution. And that can mean, that can go in all kinds of different directions. Now, I don't know where you want to go from this, but I'm just going to say something real quick, and then maybe I'll add on to whatever you say. But I'll let you give your spin on that. Hold on 1 second.
Sure,
let me finish.
Sure.
So quickly, though, if you look, and once again, this goes back to 1930s, late 20s, early 30s Germany, the first thing they did, was they went after trans. And then they went after the mentally ill, so-called, undesirables, and people that were unfit to live, according to them. Or that they were doing these people, this was euthanasia in a sense, because we were, like you would an animal or something, because they just, their quality of life was so poor that you were doing them a favor by, extinguishing them. That's where it started, and then of course that went on to the socialists, and then forward. So, that this is, going down that trajectory happening once again. And I think that's why this legislation is being put into place, because they want to make it illegal for you to be homeless. They want to make it illegal for you to be broke and poor and to buck the system, so.
Yeah, a couple things. I mean, one, if they implement it the way that it looks like they're going to, there isn't even close to room in existing facilities. There isn't room in existing facilities for the people who are in there now. So you're talking putting people in some kind of, well, let's just be honest, some kind of prison for having a mental illness instead of trying to help them, which part of that goes back to the 80s and Reagan, when they basically took the people who were in mental institutions at that time and said, no, you're on the streets now.
Right.
But the other thing is, I mean, not to go into details and whatnot, but Steve and I could both be on the list we're talking about. Not to spill any beans that you don't already know, not most people, but a lot of people that are either recovering or in therapy or whatever. I mean, we're not. It's not like the trans stuff where it's like 0.01% of the population. We're talking about a lot of people that including you guys. And all of a sudden he's got this tool that like, oh, this guy's, said the wrong thing or whatever. Oh, look, he's on Zoloft. Oh, look, he's on, propanolol or whatever. Bam, there is nothing legitimately good about this legislation or this EO. I forget which one it is, but there's nothing good about it.
Right, and of course they're selling it like this, like, well, but this is not what it is. It's not saying we're going to give more money and more resources towards helping people,
which would be a good thing. Which would be a good thing. This is more in the slant of we are going to forcibly institutionalize people. That is like, there's nothing about, okay, like you just mentioned, how do we facilitate these people who need help? And why do they have to be institutionalized in every case? What about put them into a home and give them some therapy? Right.
But that's not what they're saying. They're just basically
and just to explain, the way things currently work is if somebody were to have a breakdown, let's just phrase it that way, you would normally go in for a week or two, get reevaluated, re-diagnosed, whatever, come out, hopefully you're on a better med, all that kind of jazz. But now you're lucky if you get into a facility like that, because it's more likely, as we said, that you just go to this weird prison thing where you get no help whatsoever.
Right, they're not, look, this is not about helping the situation. And, I'm going to take this back to discussions we've had in the past. In some cases, in a lot of cases possibly, the individual is not really mentally ill in a way that people think. They're having a sane reaction to a profoundly sick society. Because, I'll go back to that quote. It's no measure of health to be well adjusted to a profoundly sick society. So, certainly you don't want to have a situation like we had under Reagan where people were just released into the streets without any assistance or guidance or help, And there should certainly be places available when people want to get help on their own, which is the funny thing is because, look, for the people who already want help, they can't get it because they can't afford it. I've talked to a lot of these people. They want resources and they're having difficulties getting them, through their insurance. Nobody who can pay $250 an hour for, counseling. And, or, tens of thousands for certain,
Or $100 a pill if you don't have insurance or whatnot.
Right. And this, forget about the pills. But anyway.
Well, still.
Like, to get the help you need.
Right.
So, and a lot of this help that they need is just to unravel this sick system and just to come to terms with themselves and what people are in general and just make some adjustments to how you're reacting to the world. So, you don't want that to happen. You don't want to say, look, hey, it's a free-for-all, everyone on their own, and we're not going to, or have the situation prior, because this was the excuse that, one of the excuses Reagan was using back in the 80s was, well, these people are institutionalized without their free will, so we're going to give them their freedom. That wasn't the case.
That wasn't necessarily what was going on.
No, it was more or less like, their whole thing was, look, these are torture chambers for people, and we're just going to release them to the streets. Like, that's going to be any better. Because they didn't want to spend federal money on helping people. That was the bottom line. It had nothing to do with helping or making things better or progressing society. It was just about, we're not going to spend money on people we think don't deserve it. Because they're mentally unfit to work in the cogs and the wheels of capitalism. Because that's basically what they want to do. When you go to any of these places, they're just going to be like, well, how do we get them so that they can function in society, meaning make money for fucking rich assholes? That's basically what mental health is in this country. So, the idea of it, so, and there's all kinds of things going on too, the DSM-5, but now they're up at number 5 or whatever
I was going to say 9 or 10.
Who knows what that is? I think it's 5 or 6, but
diagnostic, yes.
Let's just say, when this was originated, it wasn't meant to diagnose. It was something the insurance companies were told them they had to do.
Oh, I get your point.
And
and now
it's turned into like the Bible for these guys. And in a lot of cases, there's so many overlapping things that are happening when you're talking about these different diagnoses. And what a lot of people are discovering on every level, whether it's psychiatry or psychology, psychoanalysis, or whether you're into whatever, neuroscience, whatever you're into, or even disease model or whatever, starting to realize a lot of this is just trauma. it's some form of CPTSD or PTSD, and the more and more that people are diving into this, that they're starting to realize this, and all the pieces are starting to come together in a lot of ways. So it just manifests itself a little bit differently in different people in different ways.
Okay, so then we had part 2 of this question, which was what's going on with the Medicare Medicaid changes from the big,
and this kind of feeds right into
from the big nasty bill.
Right.
And what a lot of us,
we got a long time on this.
Yeah, what a lot of us thought, or at least what a lot of us who were reading the bills thought was, oh, it's not supposed to go into effect for 30 years. That's kind of a good thing, kind of a bad thing. Well, unfortunately, for better and worse, and mostly worse, even though the bill explicitly says that it's not going in for another 3 years, because it's in the bill, the hospital entities are having to reconfigure their budgets based on that knowledge, which means that it's affecting people as early as like last week. I mean, it's already hitting because of the bigger realm of how the medical system works in the United States. Do you want to add to that? Or?
Well, I mean, what can I say? Like, it's catastrophic for a lot of people, and it's going to cause a lot of pain, suffering, and death.
Well,
what else?
And even for the people who are least affected by it, which might or might not be us, but assuming that it's us, our premiums are going to go up higher because of it, and we're going to have fewer doctor choices because of it, and nobody's going to be unscathed. Is my point. It's a question of a question of how badly, not if.
Look, if hospitals don't get insurance money from these people, and they still have to service them in some way, shape, or form if they come in for emergency purposes, or they have to get something done, and they go ahead and do it, who's paying for that? Because they're going to start. They're going to say, "Oh, we got to up this because we got to pay for that."
Right? They're going to say, "Well, we can't really afford to pay less because it still costs us just as much." So they're going to have to raise their rates. I mean,
for everyone else.
Yeah.
So instead of $300 for a procedure, now it's $900 because 2 people had to get it for free.
Yeah, or if you're lucky, 400 or 500, whatever. It's gonna jump faster than it would have otherwise.
Exactly.
Is kind of what we're getting at. Since I haven't seen it with my own 2 eyes, that's about all I can say about that one. But it's definitely a point that needed to be out there.
Yeah. It's not good.
No.
So yeah, to wrap things up, once again, these pieces of legislation are not being put in place to effectively help or service people in need or to advance society in any way whatsoever. This is another way that they can be cruel and vicious towards people they don't like or don't want to pay for, which are, the people that they consider deemed unworthy, or the elderly, or anybody they can't make money off of or make money for them.